Hi guys, so my name is Michelle and today I'm going to be conducting a neurovascular assessment. This is my patient. So the first thing that you would do when you walk in for any type of assessment is to introduce yourself and to wash your hands. So I'd say, hi, my name is Michelle, I'm going to be a nurse today. How are you doing?
Doing good, how are you?
Good. So then I would wash my hands. The importance of a neurovascular assessment is to make sure that there's no risks, there's nothing wrong with the patient, and you'd always want to document this and notify an appropriate provider if there's anything that you see that's wrong. The components of the assessment include pulses, capillary refills, skin color, temperature, sensation, and motor function. Pain and edema are also assessed during this assessment, and you'd always want to check everything bilaterally, because if there's any slight changes, that could mean that there's some type of issue there. So you'd start with pulses, and you do your peripheral pulses first, so that would include your brachial, your radial, and your ulnar. Brachial could be found on the inside, over here, and then you have your radial and your ulnar down here. You also have your lower extremity pulses that are below the waist, so you have your femoral, your popliteal, and your two pedal pulses. You want to assess all these pulses. Usually the lower extremities could be hard to find, but if they're extremely weak, you'd want to make note of that. You always want to use a 0 to 4 scale, 0 being absent, 4 being strong and bounding. You'd also want to document if the pulse looks weak, diminished, or if it's just completely absent. Another intervention that you could use is a Doppler scanner. If the pulse palpation site is challenging to find, you could use this especially on the lower extremities where it's harder to locate these pulses. Another important thing to know is when you're doing any type of pulses, so for example, you'd want to have your fingers there. Always use a watch with a second hand, or a wall clock with a second hand, and you would count for 30 seconds and then multiply that by 2. And that goes for all the pulses. So next you have your capillary refill. For men it's usually easier to assess this, but for women, if they're wearing artificial nails or if they have nail polish on, it can be hard. So what you do is on the fingers, you want to press down on the nail bed, and then when you let go, all the colors should come back within less than 2 seconds. This will give you an idea of how well their perfusion is, which is also extremely important. Some things that can affect your capillary refill is age, the temperature, if there's any ambient light or pressure applications. So you want to just make sure that you're performing this skill correctly. Good lighting, if there's any temperature, just make sure you document that. Next, you would want to assess the skin color. This is important to do it bilaterally, so when you're assessing the patient, if you want to stand in front of them, so that you can do, this side of the arm, then the same side of the arm at the same time, so that you don't miss anything. Colors to look out for: any cyanosis, so that would give you an idea that there's some type of lack of oxygen someplace, and you'd want to document that. If there's any pallor, so if they're super, super pale, and if that happens on elevation or not elevation, things like that to keep in mind. If there's any yellowing of the skin, that could indicate jaundice, something's wrong with the liver. If there's any molted colors or purple blackish colors, also make a note of that. That could indicate an inadequate venous return. Next, you would want to do temperature. Same thing as the color. You'd want to do this bilaterally, so you could take the back of your hands. You could feel the skin. Skin should always be warm to touch, never super hot or cold. Cool skin could indicate any inadequate arterial supply, and warmth or really, really hot could indicate inadequate venous return. So next on the list would be sensation. This is really like an interviewing portion, so you'd want to ask the patient about any sensation changes. So I'd ask my patient, do you have any numbness anywhere in the body?
No.
Any tingling, maybe on movement with the fingers and the toes?
No, ma'am.
No. Okay, you'd also want to ask, do you have any pressure or burning sensations at all with any range of motions?
No.
No, okay. And you could also do some type of sensory exam with light touch and cotton swabs to also just stimulate some type of sensation. Make sure that there's always feeling. Can you just lift up your foot? There's also some where you would roll up the foot, things like that, to just check that the sensation's there and that they're not getting any adverse reactions to that. Nerve involvement could also be a factor for which a patient could be getting any of the tingling or numbness. So if there's any type of shooting pains or tingling coming down the legs, you could also check out the sciatic nerve, things like that to keep in mind when you're assessing the patient. So next you'd want to assess motor function. So for this you could have the patient raise each arm up, so they can raise each one up. They can go out to the side, good, up to the other side, look up and down, side to side. There's also lower extremity exercises you can do when the legs go up, if they can go out. It's hard to do when he's sitting down, but you can see he has good range of motion. So next is pain and edema. Pain can always be assessed using PQRST. It's a good way to follow the type of pain they're having, the quality, the onset, if it radiates anywhere. Always using a scale of 0 to 10 to assess what type of pain on the pain scale. Always ask if it's relieved with any Tylenol, Advil, any over-the-counter medications. Another important thing to keep in mind with pain is facial expressions, if they're appropriate or not. Sometimes with nonverbal patients, you can go by just the look on their faces or any type of nonverbal cues that can give you a hint to what type of pain they're feeling, if any. And lastly, edema. So edema could easily be spotted. It's just swelling, inflammation of the skin. And some interventions for that could be elevating whatever type of limb there is, or maybe using compresses, depending on what the problem is.